that diabetes causes more cardiovascular disease. Sorry, there was some background noise. So, diabetes is a cardiovascular disease. That's what I'm trying to stress on everyday basis. That the diabetes is, if you know, if you're concerned about diabetes, what we should concern about the cardiovascular disease. And diabetes causes more cardiovascular disease uh, in patients with hypertension and high cholesterol. So मैं यही बार बार क्यों रिपीट करता हूँ, क्योंकि ये बात जानना जरूरी है कि अगर अगर आपने सुना होगा कि यार मेरे फ्रेंड थे ठीक ठाक थे कुछ हो गया, तो क्यों हुआ, क्यों इसलिए हुआ क्योंकि इनको शायद डायबिटीज थी जो अनडिटेक्टेड थी, या शायद हाइपरटेंशन जो को बोलते हैं 140/90 है सब कुछ नहीं। तो ये सब रिस्क फैक्टर्स फॉर हार्ट डिजीज है, थोड़ी सी डायबिटीज, थोड़ी सी ब्लड प्रेशर, थोड़ी सी कोलेस्ट्रॉल, दे ऑल एड्स अप टू कॉल हार्ट डिजीज. सो आई कीप व्हाई आई एम स्ट्रेसिंग ऑन मोर इट, बट एज यू नो ये कोविड टाइम्स में इट इज वेल नोन दैट patients with diabetes are doing unwell, and that's what the max healthcare data is also suggesting, that patients with diabetes, they do much worse than anybody else because they cause more heart attacks, strokes in patients with diabetes. So it's very important to understand that patients with diabetes should be very careful about risk of heart attacks and strokes, and that's what the main reason of worrying about diabetes. If diabetes is not causing a risk of heart attack and stroke, then it's not a very simple disease. But why it's a complex disease? Because it causes predisposes to heart attack and stroke. So the question is, what do we do? The very important is to screen, test, and treat. So you must get yourself screened for diabetes, blood pressure, cholesterol, not simply just diabetes. You must get your sugar test, HbA1c test, cholesterol test, along with the kidney, liver function test at least annually. Those are above 30, because majority of the population is getting obesity. So it must be screened and screened for diabetes. They tested for other tests like blood pressure, cholesterol, and then at the same time we should be treating for those cardiovascular risk factors. Now, the importance of diabetes, that we must treat diabetes treatment with what we call as the glycemic agents like metformin and other agents. But when it comes to treatment of cardiovascular disease, the important aspect that how is your blood pressure, how is your cholesterol, how much you're exercising, are you smoking or not. So it's very important to understand and just not to ignore just diabetes as simple blood sugar. It is associated with the blood pressure, cholesterol, and other diseases, and it's very important to prevent those happening. Now, to prevent those happening, it's important to walk 30 minutes a day, 150 minutes per week. And if you smoke, must stop smoking. I must say that we recently had somebody who had a diabetes as young as 28, 30, had a heart attack suddenly and ultimately died. It's very common, to have patients with diabetes as young as 30 having heart attacks, especially if they smoke. So it's very important to diet, exercise, don't smoke, cut down your weight reductions, eat less saturated fat, and eat more fruits and vegetables, and also eat less salt, which is important. Salt is one of the biggest contribution for hypertension. And at the same time, get your blood pressure treated. Consider cholesterol lowering medications like statins, group of medications, so that we treat you overall. We just don't treat you of diabetes. We also treat for diabetes along with lifestyle changes. Get your blood pressure treated, get your cholesterol treated, so that we can prevent risk of heart attack and stroke. The best way, obviously, is to prevent diabetes happening. But today's discussion is more about reducing the risk of heart attack and strokes with associated with diabetes. And we in India, another thing which keeps stating, and some of it could be repetition for some of you who've been following my Facebook, that we Indians have 3 times more risk of having diabetes than the Western population for the same risk factors. Like, you for the same body weight, we have 3 times much risk for diabetes. And similarly, once you have diabetes, you have 3 times much more risk of having heart attack and stroke. So it's very important to get yourself associated, treated for all the aspects of diabetes. So this is going to be short discussions because I've got some other work to do. So any questions, I'm happy to take. To take L-troxin even when the thyroid report is normal. So I think, Pragya, it's very important to understand that the TSH is like thyroid stimulating hormone. And if, for example, if you stop if you're taking 50 microgram L-troxin and your TSH is 3, if you overtreat you, the TSH would go down. If you undertreat, you will go up. If you're maintaining the thyroxine with the 50 microgram, you need that 50 microgram to continue to maintain the TSH. If in case, if you're overtreating you, the TSH would go down. Then we cut down the dose. If your TSH is not down, it means you're treating the right dose. It's very important to understand. For example, my TSH is 3 and I start popping allotoxin for no reason. I would know in a month's time my TSH would go down. So it's very important to maintain. If your TSH is normal, it means it means you need that much of dose. So it's very important to continue the medication. If your TSH is going down, say for example 0.1 or 0.1, then it means you extra dose. If your TSH is say 1 and 3, then you need it. And especially if you're in the pregnancy group, if you're wanting pregnancy, your TSH should be less than 2.5, and you must continue the medication. So it's very, and if you overtreat, if you stop it, your TSH would go down. So if your TSH is normal, it means you need that medication. जितने में खा रहे उतनी की जरूरत है. And same thing about diabetes. To maintain sugar, you need medications. Mean you need it. If the sugar is low, then you cut down the dose. I hope it answers, Pragya, your question. So diabetes and cardiovascular disease, get yourself screened, diet and walk, exercise, more fruits, more vegetables. Make sure you reduce your salt intake, eating more fruits, vegetables. सब फल खाएं जो मैं बोलता हूँ धरती पे चले, धरती का खाएं, जो खाना खेतों से पेट में निकलता है वो अच्छा, जो डिब्बे में वो गड़बड़, तेल कम, मैदा कम, चीनी कम. Get yourself blood pressure treated, sugar treated, cholesterol treated. Don't see diabetes as an isolation disease. If you had COVID or COVID infection in the past, you have much more risk of having a risk of heart disease. So you must speak to your doctor about it. Oh, Mr. Oberoi, what's Oberoi? Sorry, Mrs. Oberoi. Why are initial symptoms of cardiovascular disease? So cardiovascular disease, I can have 80% blockage and I can be asymptomatic. So cardiovascular disease are defined by the risk factors like obesity, age, diabetes, blood pressure, cholesterol. They're the risk factor for it. Now, if you have cardiovascular disease, but what does the cardiovascular disease means? That vessels are blocked. Vessels, so cardiovascular disease, the vessels of the heart or the brain is blocked. Now, if they get blocked, then if you have symptoms, it means stroke, it means paralysis, or temporary transient weakness. If you have heart disease, you can have angina or heart attack. So if you're waiting for those symptoms to come, it means already late. So it should be screened, and if you are high risk, then certain tests like calcium scoring, CT angiogram, or treatment tests can be done, or MRI or the carotid vessel neck can be done. But the most important is getting yourself screened for diabetes, blood pressure, cholesterol, weight, BMI, diet, exercise in the same breath, which I keep talking about, should be screened so that you prevent the cardiovascular disease. The symptoms of cardiovascular disease, it means you're too late. It means we have not picked up the risk factors. That's why you ended up having cardiovascular disease. Anything else?